Hello and welcome to another episode of This Is What Democracy Looks Like, a podcast about deepening democracy. Each week we welcome a guest on to teach us about an idea that could help extend more power to more people in more ways, that could increase our voice in the forces that govern our lives, that could help us co-create our shared world, that could, in short, deepen democracy. I'm your host, Pete Davis, director of the Democracy Policy Network. This week, we're talking health policy with Abdul El-Sayed. Let's go.
Sing me a song, you bright branches fold. Oh, the winter's been long in the summer of growing old.
Dr. Abdul El-Sayed is a physician, epidemiologist, educator, author, speaker, and podcast host. He is formerly the health director for the city of Detroit and a very inspiring candidate for governor of Michigan in 2018. He is currently a commentator at CNN, and his latest book is Medicare for All, A Citizen's Guide. Abdul, thank you so much for coming on. This is what democracy looks like.
Pete, thank you so much for having me. Excited to be here with you and looking forward to our conversation.
This is going to be great. So, Abdul, this is a podcast about deepening democracy at the state level, showing people what concretely the chant means. This is what democracy looks like. And you had a great experience over the past years doing just that, really getting into the weeds of state and local policy. And we mean deepening democracy in the widest sense of the term, more power to more people in more ways. So let's start with your time as health director for the city of Detroit. What did you discover about public health policy during your time there? Was there any surprising thing that you didn't know going in that now that you've seen how it works, you suddenly understood and could share with our listeners?
Well, I'll tell you this. I think so much of our public conversation about politics is driven by these big, broad, relatively abstract conversations about ideals rather than the on-the-ground, real-world consequences of the ways that we try and enact those ideals into public policy. And I think working at the local and state levels is where the rubber hits the road on public policy. It's the place where we really have to do the hard work of turning big, bold concept questions into real world outcomes for real people. And I think in that respect, it's actually quite clarifying. And I'm really grateful to have had the opportunity both to work in a large city, but also to be thinking about public policy at the state level as a candidate for governor. And it's very clarifying in terms of taking the parts of our national conversation and turning them at least into what we ought to do in real places right now, rather than these big pushes about cultural tropes. And I think on the right, it's gotten to its most absurd, where we're now debating Dr. Seuss instead of COVID relief. And here we are.
And could we get concrete as health director of City of Detroit? Could you share some of the ideas or initiatives, one or two, that you tried to push and what the story was of how to implement a new idea in a city bureaucracy?
Sure. Very simple, right? We found that about 30% of our kids who would test positive for vision deficits would come back the next year testing positive for the same vision deficits. That means we knew that they needed a pair of glasses and they did not get one for an entire year. And if you can't see what's on the board, it really doesn't matter what's on the board. So we're having this big conversation about education policy, which, by the way, we ought to have. But something as simple as getting a kid a pair of glasses can fundamentally change their experience of the education system. And we don't do that in large part because it just seems too obvious, and in other parts because it's one of those things that doesn't drive clicks. And so one of the programs that we built was one just to guarantee every child a free pair of glasses delivered at school within 2 weeks of a vision test. Now, that sounds like an easy ask. The lift of that at the bureaucratic level is actually quite difficult. We had to deal with everything from the state trying to cut our funding for basic vision tests as it was, to making sure that parents had signed their permission slips so that their kids could get a full optometric exam after their vision screening, to dealing with how we bill Medicaid for the services, given that it's a reimbursable service. All of those things make the lift quite challenging and quite complex, but in the long term, right, delivers a pair of glasses on the bridge of a child's nose and changes their experience with the education system as it stands. And so we were able to execute that program to date. The program's delivered over 10,000 pairs of glasses. And sometimes when you work, even at the local policy level, the consequences of your work can be somewhat removed from the work itself. And I didn't really quite appreciate what that meant until earlier this year, actually, when I had lectured via Zoom to a group, and a young woman raised her hand and asked what I had thought about a program she's working on asthma in her local community. And she mentioned, as a sort of by the way, that, this pair of glasses that I'm wearing, I got through the program that you created. And it's left me really interested in public health in my community thereafter. And it's one of those things that you don't really appreciate what that means. But that means that this young woman, who's a freshman at the University of Michigan, one of a handful of kids who got to go to the university from her local high school, may be there in part because she could see the board and make sense of the board, and the beauty that we're all trying to unlock of education became a lot more crystalline for her. And so that's one example. Another example is we want to work on environmental justice. And for us, it meant taking on a local polluter, a Marathon petroleum refinery in Southwest Detroit, the most polluted zip code in the entire state of Michigan. And that petroleum refinery is the biggest polluter in that most polluted zip code. And when they wanted to raise their emissions of sulfur dioxide, we had to step up and pressure both the federal EPA and the state Michigan Department of Environmental Quality to reject that and actually threaten a federal lawsuit if they did not. And that's where this big conversation about the environment and climate change, where that hits the reality of our baby's lungs in a local community like Southwest Detroit. And it's very clarifying when you sieve these broad, abstract national conversations through the real world consequences of their implementations at local and state levels.
I love that. And that kind of segues nicely into the next big act after you were health director, which was you ran for governor of Michigan. And the reason I know, I'm not a Michigander, I'm a Virginian. The reason I heard about you and we all got excited about your run was that you had a very policy heavy campaign. You were running on cutting edge policies for the state of Michigan, which is not the usual blue trifecta state where you see the most cutting edge policies usually. You decided, hey, I think this appeals to everyone across all sides of the aisle, and I'm going to put it out there. And what I loved about your run is it kind of, and this is a hobby horse here on the podcast and in our organization, the Democracy Policy Network, is that people always say, oh, no one wants to hear about policy. It's all about values and narratives and things like that. But we think there's actually an appetite for bold, concrete policies that could really lead to structural change. So I'd love to hear, Abdul, about what was it like running a policy-heavy governor campaign? What was it like when the rubber hits the road that you actually have to be in rooms with people who aren't wonks and talk about the details of your various large-scale policies you wanted to bring to Michigan?
I do think it is true that we don't campaign on policy, but that's not because we shouldn't. It's because it's a failure of our political ecosystem that we have not connected public policy to the narrative that we try to push. And so it's not that we didn't run on a big, bold narrative about who we were and who we wanted to be. It's that we felt like operationalizing that narrative meant being able to tell folks exactly what that ought to look like on the ground. And personally, I come to politics from policy. I am an MD, PhD with a PhD in epidemiology. I ran a health department. I care a lot about the nuts and bolts of the thing. And you can sell people a dream, but if it's not bolted down with steel and concrete, then it's just that, it's a dream. And part of the problem is that we have been very loose with the policy precepts that undergird a lot of our ideals. And so I didn't want to run the kind of campaign that waved my hands around and said that the world could be a better place without telling you exactly what I meant by what a better place should look like. And I was really grateful to have been able to recruit a good friend of mine and a policy expert who'd worked with me at the health department, Rihanna Gunn-Wright, who's gone on now to be the chief policy architect underneath the Green New Deal, to really sit down and say, if we were to take our ideals and turn them into true ideas that should animate what a future Michigan could look like, that was truly more just, equitable, and sustainable, that answered the call for addressing the kind of systemic oppression and injustice that had been perpetrated on low-income people and people of color across our state and has held back rural communities and urban communities alike, what would that look like? And so we got to work. We launched a single payer platform called Medicare. We took on the question of water shutoffs in Detroit and the sad reality that in a state with more fresh water than any other state in the country, almost
pure
country in the
Michigan.
world. Exactly. That we are a state that offers Nestle unlimited amounts of water to bottle and sell for $400 a year, while some folks are stuck paying $400 a month. We wanted to ask, what would it look like to build an equitable education system that unlocks the potential of our kids, that does not either inadvertently or overtly pattern our education system off of the structural racism that was deployed against Black people through the New Deal. And we wrote that out and engaged with it because we felt like the only honest way to talk about our ideals was to also inform the ideas that would turn them into reality on the ground.
I love that. And even though, unfortunately, you lost that race, I think those ideas have had an impact, that you can even win when you lose when you run on policy, because you get the idea out there. Do you have any stories of how you've seen those ideas spread in the wind since?
I'll tell you this. We do mark our politics by wins and losses in terms of elections, and that's just fine. In the end, I didn't run simply because I felt like my getting elected was what mattered. I felt like the service to people in communities around our state and around the country was what mattered. And if my winning didn't accomplish that, it wouldn't have been worth it. And if in losing, we still were able to advance those ideas and reshape the circumstances in which people are living, then not all is lost. And in a lot of ways, our platforms have been picked up by races around the country, campaigns for president. We ran on universal Wi-Fi through a Wi-Fi public option, and it was exciting to see the Elizabeth Warren team pick that up and run with it. And our state level single payer remains a real model for how you could achieve single payer at the state level. And once you put ideas out in the world, they get picked up. And the beautiful thing about an idea is that it is the most truly public good there is, in the sense that once someone else takes it and runs with it, it doesn't take it away from you. It multiplies in the world. And that's exciting. And then I'm really grateful for the incredible people that the campaign gave a platform who could go on and do some amazing things, whether it's Rihanna or a lot of folks in our political team or our organizing teams who've gone on to do incredible work, or folks, my finance director went on to start a firm that now is the chief finance firm for a number of progressive challengers. So that's exciting. And in some respects, I know that in doing that's a real service, even if I didn't get elected. At the same time, I'll be back.
Let's move now to the latest book you have out, A Medicare for All, A Citizen's Guide. We want to get into the weeds of state policy shortly, but one national Medicare for All question, which is the last act of Medicare for All was the 2 Bernie campaigns. That was the thing that brought life to Medicare for All in the national conversation. Those are over. I don't think he is running again. What is the next act of the Medicare for All movement? What do we need to do next to find this next chapter?
I'll say 2 things. The first, at the federal level, is continuing to elect Congress people who support Medicare for All, and not the kind of support for Medicare for All that says, yeah, I'm for it, but I continue to take the shameful health insurance industry money to fund my campaigns. But folks who are going to go out there and fight for Medicare for All and are not secretly working with the insurance industry and the pharmaceutical industry to maintain the status quo. So that's number one. But then it also means taking the fight to the local level. You've got movements in New York, the New York Health Act, and in California, and a number of other states where people are really thinking about what would it take for us to move single-payer healthcare at the state level. And don't forget, there is good historical precedent for this. Canada's single-payer health reform started out as a provincial policy in Saskatchewan. And it was in doing that the idea spread and became federal law in that country. And we're standing on the shoulders of giants here, the folks who are pushing for state level single payer. There is real momentum to be gained by achieving this at the state level, not just for the people who live in those states, but for creating precedent across the country. Because the reality of it is, when people realize what you can have when it comes to a truly public health insurance that funds you no matter who you are, no matter what job you work, no matter if you're 26 or younger than 26, no matter if you're married or you're divorced, no matter if you turn 65, like that, you don't really have to worry. That is going to be an idea that takes hold. And all we need is a sizable group of Americans who've experienced that for that idea to spread.
One of my heroes, Ralph Nader, says 1% of Americans are the population that have made change at different points in history. It's all we need is 1 out of every 100 Americans to be devoted to giving a few hours a week to make things happen. And I think we definitely is within reach if we can get 1% of Americans working on a local level in chapters fighting for Medicare for All. So let's now get into, there's the fighting on the national level for Medicare for All, getting Congress folks elected, affecting the 2024 race and 2028 presidential races. But I'm very interested in this state prefigurement of Medicare for all. I've seen different thoughts on this. There are folks that say, let's try to get state level single payer. There are others that say that's going to create bad precedent. What happened in Vermont, where now everyone cites even liberal Vermont couldn't even do it. Others have said there are other health things we can do, like all payer rate setting, state level public options that can get us moving in that direction. Some say we got to wait till Congress passes something that frees up certain funds so we can do that. I know Ro Khanna has a bill in Congress to try to free up federal funds to create state level single payer. Where do you stand, Abdul? Give us a lay of the land.
Look, I support state level single payer. I want to speak to the politics, and then I'll speak to the policy. Politically, nobody ever remembers that you lost 10 times if you won. It's if you fall 9 times, get up 10 and you're still standing. And so at some point, I don't worry as much about the precedent set by not succeeding, because the best way to address that is to try again and succeed. This sort of question about precedent, I just don't think is a fair one. And then the other side of that is that don't forget that the most powerful movement for Medicare for all is going to be anything that is active toward achieving single payer, whether it's at the federal level or the state level. And these two are one in the same fight. And you can be an activist in New York working on the New York Health Act and also be supporting congresspeople who would support Medicare for all in their primaries. And so they're not mutually exclusive. From a policy standpoint, there are two serious challenges. The first is the challenge of the fact that state budgets have to be balanced at the end of every year, which means that the onboarding of a very extensive and large support program like state level single payer becomes a challenge. The best way to address that is actually Medicaid waivers, which you don't necessarily need more legislation to push. I definitely support Congressman Khanna's effort in that respect, but it's written right there in the ACA around empowering CMS to offer what is in effect a reformulation of dollars for Medicaid and potentially Medicare to support and backstop states in their effort to doing this. The second is Erisa, which is in effect a federal preemption of state laws that would change the configuration of how large employers engage with their benefits packages. And that becomes I actually think a bigger challenge. And I think we do need federal law to take on Erisa and really rethink the kind of leadership that states can offer in terms of bringing corporations to the table as a resource for some of the funding for this, insofar as their employees would benefit tremendously from a state level single payer plan. Those are really the two big policy challenges. We're going to need federal leadership to take them on. And at the same time, they are worth fighting for. Most of it, though, is going to be people on the ground fighting for this system. It's popular among some folks to think that there's some legislative trick that could be deployed to get us Medicare for all tomorrow. That's just not how this works. And even if it were to work, a house of straw is that much easier to blow down. We need a movement of people who are willing to take on the power of the corporations that have put a chokehold on our healthcare system, whether it's insurers or the pharmaceutical industry or the device industry or hospitals, and build a movement of people who are inured to their disinformation and the money that they spend to move it to create this change. That's what's going to do it. Whether that's pushing at the state level or the federal level, it's the same fight, and we need to be taking it on at every level.
One wonky question. We'll end on a hopeful, non-wonky question. But one wonky question, you keep citing this New York Health Act. What is their model of kind of figuring out the details of this? If you could walk our listeners through that.
Yeah, it's a state level single payer plan that would in effect do what Medicare for all would do at the state level. And this is, I think it's the most powerful movement forward for state level health reform, simply because it is being driven by a collective of people who are committed in a state that has the potential to get this done. The details of the transition, et cetera, I would encourage folks to read them, but basically they would phase out private health insurance and phase in public health insurance through New York State over a period of time, similar to what Medicare for all would do at the federal level.
Final question. What advice would you have to people who want to make change at the state level? People who want to have a life like you. I like building up our guests and saying you're an amazing kind of civic superhero here, but we also like saying everyone can be a civic superhero. And you dived in and made a lot of change and are still making it. What advice would you have someone who's just getting started in that process?
I'll tell you this, I'm no superhero. The superheroes are the folks who are in far less privileged positions than I am, who are working to make change, even as they live through the consequences of our failure to make that change and show up and engage with their public officials. I would tell you that you need to know your state representative, your state senator on a first name basis. They need to know exactly who you are and what you're fighting for. I would get involved in primaries at these state rep and state senate races, and you'd be surprised how much you can get done by being able to drive your policymakers toward the kind of legislation that you want to see done. The other thing that I would say is make sure that you're consuming a solid diet of state and local news. We are facing a crisis of state and local journalism right now, and the best way to address that is to become a subscriber to state and local journalists and journalism, and make sure that you're consuming that. So what's going on sometimes in the dead of night in your state house, because it affects your life in some profound ways. And so be a great consumer and a great producer of social change and movement at the state and local levels. Know what's going on and know who to talk to change it.
Thank you so much, Abdul. The latest book is Medicare for All, A Citizen's Guide. Thank you for coming on. This is what democracy looks like.
Yeah, thank you for having me. I hope folks will check it out. You can go to MedicareForAllBook.com. And then I also recently launched a Substack newsletter. It's called The Incision. You can go to incision.substack.com. I write on Tuesdays and Thursdays and most Sundays. So I hope folks will check it out. And then, of course, you can listen to the podcast, America Dissected, wherever you get your podcasts.
Appropriate doctor-themed names. Thank you, Abdul. Have a great one.
Thank you, Pete.